So hello everyone. Today we are going to talk about the emergency drug and let's talk about adrenaline. Adrenaline is also known as epinephrine. It is a vital hormone produced by the adrenal medulla, the inner part of the adrenal gland that prepares your body for rapid action in response to stress or danger. This process is famously known as flight or flight response. Now let's talk about the adrenaline rush, the physical effect of adrenaline. When your brain perceives a threat, it signals the adrenaline gland to flood your bloodstream with adrenaline within minutes. This triggers several immediate changes like in heart and lungs. Your heart rate and blood pressure skyrocket to pump more oxygenated blood to your muscle and brain, and in lungs airway dilate to increase oxygen intake. In vision and senses, your pupil dilate to let in more light and sharpening your visions and overall sensory awareness. Energy boost. The liver quickly converts stored glycogen into the glucose sugar, providing an instant rocket fuel for a physical exertion. In pain suppression, adrenaline can temporarily mask pain, stress-induced analgesia, allowing you to keep moving even if injured. Efficiency. Non-essential processes like digestion slow down to prioritize survival critical organ. Now let's talk about the common triggers that induce the release of the adrenaline. So while evolving for life or death situation, modern triggers include extreme sports like skydiving, bungee jumping, or racing, emotional stress like public speaking, exams, or intense arguments, entertainments like watching horror movies or riding roller coaster, in health issues like chronic anxiety or rare tumors like pheochromocytomas. Now let's talk about the medical application of the adrenaline. Synthetically produced adrenaline is used as the first line treatment for anaphylaxis, cardiac arrest, and severe asthma. Anaphylaxis, adrenaline reverses severe allergic reaction by opening airway and raising blood pressure. In cardiac arrest, it is used during CPR to help restart the heart. In severe asthma, it relaxes airway muscles to restore breathing. Now let's also talk about the downside, and the chronic exposure of the adrenaline may induce the short-term effect like shaking, jitters, dizziness, and insomnia. In long-term effect, there is increase in high blood pressure, heart disease, weight gain, and persistent anxiety. So to manage excessive levels, technique like deep breathing, regular exercise, and meditation help activate the rest and digest, that is parasympathetic nervous system, to bring the body back to the equilibrium. Now let's talk about the synthetic use of adrenaline according to Nepali Society of Critical Care Medicine. So talking about the mechanism of action of the epinephrine or adrenaline. So adrenaline affects by B1 and beta 2 agonist. It has positive inotropic and chronotropic effects. So beta 1 is primarily present in the heart and kidney. So in heart, it increases heart rate, that is positive chronotropy, and increases contractility, that is positive inotropy. In kidney, it stimulates renin release, which helps regulate blood pressure, and it also acts on the beta 2 receptor. Beta 2 receptors are primarily found in the lungs, and it is predominantly found in the bronchioles of the lungs and vascular smooth muscle, uterus, and liver. In lungs, it causes bronchodilation by relaxing of the airway smooth muscles. In blood vessels, it causes vasodilation by widening of the blood vessels, particularly in the skeletal muscle. In uterus, it causes uterine relaxation. It is also used as in tocolysis. In metabolism, it stimulates glycogenolysis, the breakdown of the glycogen to glucose, and the gluconeogenesis in the liver.